People living in more deprived areas of England and Wales are more than twice as likely to die if they become infected with coronavirus than those living in more affluent areas. That's according to the Office for National Statistics, as our social affairs correspondent Michael Buchanan explained.
If we look at this graph, which shows all deaths in England in the 6 weeks since the 1st of March, you will see that on the right-hand side, that's the poorer areas of the country, and you'll see that they have had the most deaths with the richer areas on the left-hand side. If we now add in deaths of Covid-19 related, then you can see the difference. You can see on the poorer areas that people in poorer communities are dying disproportionately. Now, if we think of London, for instance, it has seen the highest levels of deaths, but the city has not suffered equally. All deaths in an area like Tower Hamlets, which is quite poor, are about 1.5 times higher than they are in a richer area like Bromley. But if you add in COVID-related deaths, then they're 2.5 times higher, and that gives an indication of what's going on. Now, public health officials will want to examine the data closely, but they will be certainly looking at certain things, such as underlying health conditions, cardiovascular disease, obesity. They are worse in poorer areas. They'll be looking at how close people live together, not just in blocks of flats, but in households, levels of overcrowding. And they'll also be looking at economic things like, can people who live in poorer areas, is it harder for them to actually work from home? It's an ongoing situation, but it seems we went into this crisis unequally, and we're going to...
Michael Buchanan there reporting. There's some really interesting stuff in this ONS analysis, so let's speak to Danny Dorling. He's Professor of Geography at Oxford University and author of many books and publications on deprivation. Professor, it's great to have you with us. Can we just take a step back and start with how this virus came into the country? Because it strikes me the slightly unfair thing about this is it's those who were travelling around the world, the more affluent members of our society, who caught it and transferred it.
Yes, when the virus came into Britain, we looked at the profile by deprivation then, and it was the opposite to now. There were far fewer cases, of course, but it was some of the most affluent parts of Britain, areas from which people are more likely to have gone skiing in Italy, for instance, which had the higher rates, and places like Kensington and Chelsea in London. However, as the virus has spread, it spreads into the densest cities first, in particular London, and it moves through London and affects the poorer areas which are near the centre, and the same in the West Midlands, the same in Birmingham. People are much more crowded in these poorer parts of our cities, and often in worse health overall. This has been the case for years and years. Britain has some of the worst health inequalities in the whole of Europe, and this virus moving through the country is revealing some of our weaknesses and some of our inequalities that we had kind of taken for granted.
There are crowded parts of affluent areas of the city. Canary Wharf is a good example, and yet the infection rate is higher in places like Hackney than it is in Canary Wharf. So why do you think that is the case?
Well, often in Canary Wharf you have a single young professional living in a flat, or maybe a young professional and their partner. Whereas in poorer parts of London, you have families squeezed in. In the very, very worst cases, if you remember, we had about 100,000 children who were homeless this Christmas. They're living in B&B accommodation, a single bedroom with their parents or parent and their siblings. And they've been living in those bedrooms for weeks and weeks and weeks. Now, if somebody gets the virus in that situation, they're absolutely cramped. And we know from what happened in Italy and Spain that the denser the occupation, the closer that families are packed together when this thing comes, the higher the viral load and the more dangerous it is. Whereas, as you're more affluent and you have more space, you're not pushed together so much. And on top of that, people who are poorer are much more likely to have been forced, in effect, to go out to work to get a wage, often doing absolutely essential work, such as serving people in supermarkets. But their chances of getting infected, of course, are higher because they're out. Whereas people who are more affluent, who can work from home or who don't have to work, their chances of being infected are much lower. And those who don't have to go out at all, the chance is very, very small.
There are some new figures out today about food banks, which are giving out record amounts of supplies. Demand is up 80% on the same period last year. And what is striking about those figures is the number of children impacted, the number of families with children that are falling into the crisis. And it strikes me that as we come out of this crisis and take some of the support away, it's those families that we're going to have to look after perhaps more than we did before.
Oh, so much has to change. Before this crisis hit, we were seeing an absolutely enormous rise in child poverty. The Institute for Fiscal Studies was producing statistics showing as we were going from a quarter to, in some cases, a third of all our children living in poverty. And the danger of having accepted this, the danger of having put up with this situation, the danger of having cut so many social workers, so many local public health authorities and so on, is that we had no resilience. We were completely unprepared for when something like this hits. We were feeding our children, huge numbers of our children, through free school meals at school. And that isn't a situation you want to be in as a country. And it takes this pandemic in a way to show that that is the point.
Just very quickly on that point, do you think that the inequality in our society that you were describing there, do you think that that lies behind the fact that we have a higher concentration of the virus here in the UK than many other European countries?
There will be so many studies to come trying to explain why. It does look like the UK has done worse than other countries in Europe, trying to explain why. Initially, we look at government policy and government reactions, but I suspect over time, when we look at the differences between different parts of Europe, we'll find that it was actually the underlying structures of society that played a key part in this. And we've only got to look at the United States of America and what's happened over there as the virus has moved through to see how a really unequal society does badly, whereas a very well-organised, equal society, of which we've got many examples in Europe, they often are the ones that do far better when a tragedy like this hits. In Norway, which went into lockdown at the same time as the UK, there's been a study of Norway and of the UK. People have not been thrown into destitution in Norway because unemployment benefit pays you 2/3 of your normal salary. Whereas in Britain, most middle-class people have no idea what universal credit would mean for them because they don't even think about ever having to live off benefits. And this pandemic is exposing the enormous differences between living in somewhere like Norway, somewhere like Germany, and somewhere like England.
Really interesting. Professor Danny Dorling, thank you very much for your time. Thank you. We'll soon be entering our 7th week of this lockdown in the greatest restriction on daily life since World War II. The vast majority of people in the UK are obeying the lockdown rules, and new research suggests many would be uncomfortable leaving home even if the government ordered an easing of restrictions in a month's time.